And lower back pain, you've probably experienced it at one point in your life. A doctor from Alvarado Hospital joins us with advice on some much-needed relief.
San Diego 6 News in the morning. Your station for balanced news.
How many out there have lower back pain? Come on, who doesn't? This morning, Dr. Ted Dreisinger from Alvarado Hospital joins us this morning with more. He's the clinical coordinator of the SpineZone at the hospital. Doctor, thanks so much for being here. We appreciate it. Okay, so everybody out there has lower back pain, but what can we do to not have lower back pain? Some things that people might not know that they haven't heard before.
Well, you know, I think, Alice, one of the most important things people need to do when they've got back pain is exercise. And when you're in pain, it's pretty hard to do that. 90% of us, 80 to 90% of us will have back pain at some time in our lives, most of us between the ages of 35 and 50. So when you're in pain and have an episode of back pain, the first thing is to move. The second thing is to prevent back pain is how you lift and how you move in your daily lives. So posture is critically important. If you slump, chances are pretty good that you'll have some discomfort over time. Lifting is important. We always hear that you should lift objects between your knees and lift with your legs, and that's an important idea. But the most important thing is that you keep the object close to your body. So sometimes it's safer to keep your legs straight and lift something directly up close to your body. That way it doesn't put as much strain on your low back. And basically the idea is if you can't get something between your knees to lift, don't lift it. Ask somebody else.
And by close, how close do you mean?
You can touch your body with it. Bring it right up, sliding right along your torso. The closer, the better.
And people don't necessarily, they might think that the lower back muscles are so strong, but really it's other muscles that are so much better, the core and other things that have more strength, so if you can lift with other things, right?
Well, you know, that's the curious part about it, because in most spine rehab, we strengthen the core. But people don't go to the doctor with a pain in their stomach, they go to the doctor with a pain in their back. So at Alvarado, we strengthen the back muscles, which is really important in that whole structure of the core, abdomen, and then to the back. So really key to this is strengthening the back muscles, and that's what we do the best, and that's why we're a little bit different in the San Diego market.
What kind of things do you guys do with that? How do you make it happen?
Well, we've got some pretty big machines that we use to test people to find out what their strength is, and then from that testing strength, then we prescribe exercise safely for them. So it isolates the pelvis, stabilizes it, kind of like if you were sitting in a bucket of concrete and the only thing that was moving were your low back muscles. When we can isolate them and strengthen them, then we have a chance to make you better.
So you said when people are hurting in their back, the key is to move. But if you're in excruciating pain, that seems to almost, you know, go in contract with you. What do you do?
It does, doesn't it? It seems like you shouldn't do that. But injury repair is about blood flow. And blood flow only happens when you exercise. So the most important thing that people need to know when they have an episode of back pain is that it's not life-threatening. That the sun will come up tomorrow, bet your bottom dollar, tomorrow there'll be sun, Annie.
Well done, by the way.
Yeah, so you want to recognize that you're not in a threatening situation and begin to move. When you begin to move, the blood flow increases. With the blood flow increasing, it gets to the area where you've got discomfort, and slowly that will ebb away.
Any good ideas for exercise or anything that people should know in terms of that to move well?
Sure. One of the things, of course, is walking, and that's great. For those of your listeners that do yoga, the up dog or the cobra position is wonderful, and not just up and hold it, but go up and down and up and down. That kind of exercise sort of wrings the towel of the low back muscles, gets the injury metabolites or the things that contribute to injury out of the muscles, and fresh blood into the muscles. Very helpful for patients.
Excellent. So not only did we get help with our back pain, we got a little bit of musical theater in the process as well. And if you guys can't tell, does he not have a voice, radio voice as an old radio guy, and a 6'5" guy, so gotta love that.
There you go.
Extra reasons to love you here this morning. Thanks so much for being here.
Thanks for having me.
For more information on how you can head to the Spine Center, go to san diego6.com, click on Hot Topics. We got a link there on our site.